like Paul, who spoke just a minute ago, I'm going to share my personal story with hepatitis B. So my grandmother had the virus and passed it along to all her children, my father and my two other uncles and aunt. Everyone contracted the virus.
In 2002, Justin Fung received a disturbing phone call. His uncle had just died from liver cancer. A while later, Justin learned that his uncle was diagnosed with hepatitis B 2 months before his death.
I think the main takeaway there is like no symptoms at all. From diagnosis to death, it was maybe like 6 or 7 weeks.
Justin says that after the death of his uncle, everybody in his family ended up getting tested, and all of them found out that they had hepatitis B. One of them was his dad.
He was positive. He actually had advanced stages of cirrhosis and a tiny, what do they call it, module in his liver.
Doctors gave Justin's father 2 years to live.
Here's a family picture.
5 years later, he died.
Probably about a week before he passed away.
The story of Justin's father reflects a broader theme: immigrants coming to the United States from countries where the hepatitis B virus is widespread. All newborns in the United States get vaccinated for hepatitis B and C before they leave the hospital, but the 35 million immigrants living in the United States, many of them illegal, could be living with hepatitis B without knowing. It is because of that reason the Hepatitis Outreach Network at Mount Sinai was founded. The network works to spread awareness about hepatitis prevention, especially among minority groups in New York City who are at high risk for chronic hepatitis B and hepatitis C. Pani Perumal Swami, a hepatologist at the Hepatitis Outreach Network at Mount Sinai, says that hepatitis B is called a silent disease because infected people don't feel anything, and generally, a lot of people don't seek care unless they feel something.
So it is part of our guidelines that when patients who are born in certain countries go see a primary care doctor, that they get offered screening. But oftentimes when a patient is going to see a primary care doctor, it's for a particular problem, and so sometimes only that one problem gets addressed, and unfortunately screening doesn't always happen, even though it should be.
National surveys indicate that hepatitis B prevalence among foreign-born persons in the country is 5.6 times higher than those born here. In the United States, an estimated 1.4 million persons are living with hepatitis B, and as many as 70% were born in countries in Asia, Africa, and other regions where the virus is endemic.
You know, countries in sub-Saharan Africa and East Asia, including China, have the highest rates of chronic hepatitis B worldwide. And so when those people immigrate to the States and they're living in New York City, we see quite a big burden of disease, particularly in some of these communities.
The African Services Committee, an NGO dedicated to improving the health and self-sufficiency of the African community in New York City and beyond, has screened over 2,000 patients for hepatitis B in the last 18 months.
In the last couple of years, as HIV rates are coming down and patients are getting treated, there's clearly a whole preponderance of hepatitis C and B infected patients. Two different groups, but groups who nevertheless are in need of testing and treatment and haven't even been tested yet in large numbers.
Nichols and her colleagues tell people in minority groups that there is no shame in getting tested. It's brave, even, to get tested, because people who are living with hepatitis B and are in a household with newborns or small children are at risk of transmitting the disease to them.
As a blood-borne disease, hepatitis is, much like HIV, is stigmatized. Patients fear that if they are diagnosed positive, they might be spurned by the community. Young girls might not be marriageable or perhaps shouldn't have children, none of which is true. These diseases are treatable. In fact, hepatitis C is actually curable now. Hepatitis B probably will be curable within a few years.
Here's a picture. We're in Seattle at the Space Needle. So it's still early.
It was bad luck, Justin says, that his dad and his uncle were not able to catch the virus at an earlier stage.
It's a very pitiful virus that if only people got tested sooner, they can survive with it. It's manageable. People don't have to die from it.
Hakeem Mohammed from Manhattan.